Hello, I'm Dr. Manish Bhatia, your friend and guide into this world of homeopathy. I welcome you all to this foundation course, and I really hope that this will help you in taking homeopathy as a career or taking homeopathy as a treatment option for you and for your loved ones. Let me introduce myself first. I'm a homeopath who has been studying and practicing homeopathy since last 20 years. My journey into homeopathy started when I first read The Organon of Medicine by Dr. Samuel Hahnemann. I always wanted to become a doctor, but I didn't know what being a doctor means. When I read Organon of Medicine for the first time, I realized the difference between suppression, palliation and cure. I realized that in most cases, conventional medicine is not able to cure. It can palliate the symptoms, but it cannot cure in most cases. Even today, if you look around yourself, if there is a patient with hypothyroidism, the patient nearly continues to take medicine for the life, in conventional medicine. The same goes for diabetes, hypertension, hypercholesteremia, a lot of skin diseases, allergies, asthma, you name any disease. What conventional medicine is good at doing is palliating, reducing the symptoms. But the patients are never off drugs. They are taking medicines all their life. For me, this is not the ideal medicine. When I treat a person, or the object of my treatment should be to bring the person back to the state of health. That is what the medicine should be able to do. If you are just suppressing the symptoms and gradually the disease is increasing and so are the medicines, then there's something fundamentally wrong with the medicine the way it is being practiced today. Medicine is supposed to make people healthy again, not make people more and more sick gradually over the period of time while relieving the symptoms in the short term. For me, this is a very big problem with the conventional medicine as we see and practice it today. With homeopathy, it is different. Homeopathy taught me the difference between palliation, suppression and cure. Homeopathy taught me what is the difference when you try to suppress the symptoms and when you try to make a person healthy. It taught me what is the meaning of being healthy. It taught me what are the limitations and strengths of different systems of medicine. And it has been 20 years now and my love for homeopathy just keeps growing and growing and growing. And the love does not just grow because of the love for its underlying philosophy. My passion for homeopathy is fueled by the results that we see day in and day out in our practice. I see patients for nearly 10 hours a day. And it's only the clinical results that we give us the confidence to speak to all of you at this international stage so openly. So, from this point where I am so passionate about homeopathy, I am also driven to teach others homeopathy. I also want others to learn homeopathy. And today, internet is one of the best mediums. I want people to take informed decisions about their career and about their treatment options. And I want people to consider homeopathy as a treatment option and as a career option. And for this, people need to be introduced to homeopathy. And this foundation course is meant to do just that. I've divided this foundation course in 4 modules. In the first module, I'll teach you the basic philosophy about homeopathy. I'll teach you what is homeopathy, how homeopathic medicines are made, how they are administered, what are the strengths and benefits of homeopathy, what are the limitations of conventional medicine, what is the underlying philosophy about health, disease, sickness, cure, treatment, palliation, suppression in homeopathy, what is there to learn, what are the things that you need to learn to become a homeopath, and many other areas of general discussion and philosophy are covered in Module 1. In Module 2, I introduce you to the many homeopathic remedies that are commonly used. In homeopathy, we have got more than 3,000 drugs. But out of these 3,000 drugs, there are a couple of hundred which are very, very commonly used. These are called polychrist remedies, which cover a large number of conditions and are used very frequently by homeopaths. I'll introduce you to several of them which are very commonly indicated, primarily in acute conditions like injuries, trauma, cough, cold, fever, colic, dysmenorrhea, medicines that you can use at home or that you can learn more about, medicines that you will be able to see in action very commonly, and there are certain more deeper acting medicines also. The medicines do not just cover dry disease states, but homeopathic remedies are taught as states where we teach the physical symptoms, the pathological affinity, and the mental and emotional state of the patient also is covered by homeopathic remedies. After a detailed discussion about the most common homeopathic remedies, the third module is a question-answer module in which I have answered dozens of queries which beginners have about homeopathy, about biochemic remedies, about several other aspects of homeopathic remedies, their limitations, their scope in different disease conditions, their method of application. These details are discussed in volume 3. And in the fourth module, I introduce you to the further studies. What are the possibilities for further studies? What are the links? What are the books that you can read? All this is covered. It's a fairly exhaustive course for beginners, and I really hope that it will prepare you to a point where you can take an informed decision about taking homeopathy as a career or using homeopathy for treatment. I hope that this will prove useful to you, and I wish you good health. Thank you.